And we've said on our last show, one of the reasons that the cervical cancer rate is so much lower now than 60 years ago is because so many women have access to Pap screening, less so in this area.
And in our previous show, we talked about who should get Pap tests more often, meaning once a year versus 3 times a year. So we're looking at that. Who's getting Pap smears when they're supposed to? The second study looks at...
You don't mean once a year, 3 times a year. You mean once a year or
every
3 years.
Sorry, thank you. So the second study looks at the second cause of cervical cancer, which is cigarette smoking. So we are looking at who smokes cigarettes, how does that contribute to cervical lesions, and can we get women to stop smoking?
Smoking rates are higher in this area?
Smoking rates are higher in Appalachia, Ohio than the rest of Ohio and the United States. The third area is infection with human papilloma virus. So we are doing a traditional epidemiologic study comparing women who have cervical abnormalities to those who don't, and seeing what factors spring up, including infection with human papilloma virus. So we are doing research smears, testing the women to see if they have HPV in a research lab. And we're going to correlate and see if that's responsible for the disparities that we see in Appalachia.
Other than high smoking rates, are there also other behaviors that...
It's a really interesting question, because when we started, before we actually went in the field with our study, we did some groundwork where we went and we talked to people in the Appalachia, Ohio counties. And we asked them, what do you think causes cervical cancer here in Appalachia, because the rates are higher? And they all mentioned high rates of sexual behavior, early age, starting sexual
activity
intercourse
before the age of 16.
Yes, early age and multiple sexual partners. Now that didn't come from us. That didn't come from the researchers. That came from community residents.
Let's talk again why multiple sexual partners would have an effect on cervical cancer rates.
Okay, so we said human papilloma virus, HPV, #1 cause of cervical cancer. HPV is a sexually transmitted disease. You get it through sexual intercourse. So if you are have multiple sexual partners, the greater the chance that they could harbor that infection. And it's not only that you have sexual intercourse with many partners, but those partners could have sexual intercourse with many partners. And so you could see how, just like an infection, that could spread.
Yeah, and I said on the last show, and it's really worth repeating, in terms of disease transmission, when you have sex with someone, you are essentially having sex with everyone they've ever had sex with.
That's correct.
And that's why multiple sexual partners increase everyone's risk of getting any sexually transmitted infection, including HPV.
Right. The other thing I just wanted to go back to, again, what we talked about last time, was how could cigarette smoking affect cervical cancer? Because you think you smoke here and your cervix at the other end of the body. Well, first of all, smoking reduces your immune system. So the body recognizes that this DNA has a virus hooked to it and will destroy it. But if a person smokes, their immune system is compromised, meaning it can't react so quickly and efficiently, and therefore the cell could stay and progress and grow into cervical cancer. Second is we've actually seen some of the carcinogens in tobacco smoke and in cigarettes in the cervical mucus. So it could have a direct effect as a carcinogen or as a promoter for that cell right on the cervical cells.
Let's talk a little bit about what you and your research call energy imbalance that also can affect cervical cancer rates. What do you mean by energy imbalance?
Well, when we talk about energy imbalance, that's, that relates to what you take in terms of food and what you give off in terms of physical activity.
In terms of nutrition and in terms of exercise.
Right. So we are looking at nutrition and exercise in our study that's trying to look at the etiologic or the causes of abnormal versus normal. And there's been some thought that diets that include folate, some of these carotenoids.
Folate, which is a vitamin B.
Right, or carotenoids, vitamin A and things like that you get from fruits and vegetables, that those can help ward off infections or help boost your immune system. So we're looking at that to see if there's any association, just sort of more as a hypothesis generating. And then we're also looking at exercise. to see if exercise, because exercise boosts your immune system. So we are, again, we're collecting information on exercise habits to be able to look and see
So
that.
then there are a host, we think, of possible behaviors that contribute to higher cancer rates.
Right. And on the backdrop of this is sort of the environment that you live in. And we know that this is a rural area, that there's challenges with geography, challenges with the weather, challenges with economic situations, challenges with social support, with depression, and things like that. So we're collecting information on factors from the environment, the community, individual behavior, and biology, and hope to be able to then put that together to try to answer some questions.
But now stereotypically you think of a rural area as, oh, it's got to be so much healthier than a big city. There's not the exhaust emissions, there's not big factories. So of course it's got to be healthier living in rural areas. Why would we have higher cancer rates here? What do you mean by a geographical, possibly the challenges we have? What do you mean when you say a geographical challenge? What kind of...
Well, many of you know, living here, it's difficult to get from point A to point B just with a straight line. That the mountains and the roads, you know, there's not paved roads. Some of our clinics that we're working in the spring, when the floods come, they have to close for months at a time because of floods. And so there's those type of barriers that don't allow people to travel as easily to get access to health care. So that's a huge problem. Not only access to healthcare, but we're also looking at what the researchers sort of call social isolation. And we all know that we need other people to bounce ideas off, to make us feel okay about ourselves. And does that social isolation take that away from us and cause more stress in our life? And stress directly affects the immune system. If we don't have a good immune system, we can't have those Pac-Men or those soldiers that will eat those bad cells when you know they start going haywire. So all of that's interwound, and we are one of 8 nationally funded centers for population health and health disparities, and several of the other centers are also looking at stress in other health problems and other populations that have disadvantage or disparities. And one of the centers in Chicago is looking at animal models and specifically looking at social isolation in rats and how that affects measures of stress, biological measures of stress in rats. And they, in their center, are then looking at the problem of breast cancer in African American women in Chicago and breast cancer in African American women in Africa, and African women in Africa, and comparing the different stressors. So you would say, how can women in Chicago be compared to women in Africa when you're looking at stress? It's different stressors, but they're stressed. And it's the same as looking at people in rural Ohio or Appalachia, Ohio. There are different stressors.
Well, we should talk about what stress means. I mean, stress is a biochemical reaction. Explain what stress is and how it affects our bodies.
Well, stress is a biological reaction, but it's also a perception. So, so we ask people about their perceived stressors, whether it's an event that happened in their life, a divorce, a death of somebody, or even, you know, you could have a lot of people around you in your family, you know, your husband or your, but then they might stress you.